Hello, this is Roy again to talk to you about my squint surgery, which I spoke to you about yesterday, day before yesterday. I did the first video yesterday and I had my operation yesterday morning at about 11:10. I went to the James Paget Hospital, Mr. Watson's department, and Dr. Raja did the operation, which is a bilateral lateral rectus resect, which is the outside muscles on both eyes were detached from the eyeball and moved to a position further back to allow my divergent squint to centre better. Well, the result is, I'm going to take my glasses off in a bit, the result is pretty close, and Dr. Watson, Mr. Watson said that he'd put the muscles on an adjustable suture so that when my eyes have settled down in a few days' time, this is what day are we today? Good Friday. This is, yeah, Good Friday, and 2013, and Mr. Watson's going to see me again on Tuesday, which is the day after Easter Monday, which is just 5 days away. Friday, Saturday, Sunday, Monday, Tuesday, 4 days away now. And he's going to, in his words, he's going to tweak it until it's more to his liking. He said that I would be more likely to suffer double vision if my eyes were perfectly straight, but putting the muscles on to adjustable sutures gives him a chance to tweak it, as he called it, and he'll do that on Tuesday. Well, if I come a bit closer, you'll see the result is pretty near straight. It's not dead straight, but it's a lot better than it was 2 days ago, and I'm quite happy with how it is. My eyes are sore but not unbearable, and it feels as if I've got something in them. It's just sort of irritating, but he's put me on cocodamol for pain relief, and that's working pretty good. Last night I came home from hospital at 9 o'clock in the evening, and I had the best night's sleep I've had for months, and I woke up at I didn't go to bed till about 2:30 because I was pretty much buzzing still, but I woke up about 2 minutes to 9 and looked at the clock, and I thought it was going to be something like 2 p.m. I felt as if I'd had a really good sleep, but I'd still only had 6 hours. But the operation, I left the ward, I left the Charnwood suite at the James Paget Hospital at 10:10, and I walked down the just 2 corridors to the Windsor suite, which is where the operating theatre is, and it's dedicated to ophthalmic operations, and they got me prepared in the anaesthetic room, and which was quite a bit colder than the temperature in the corridors or the waiting room. I guess that's infection control. and put a cannula in the back of my hand and an oxygen mask on my face, and encouraged me to take deep breaths sucking oxygen for a few minutes, and then administered the pain relief into the cannula in the back of my hand, and then administered the anaesthetic, and it was just drifted off. I wasn't aware of anything until I woke up in the recovery room with a smashing chap. Mr. Raja had done the operation, Dr. Raja had done the operation, and Ren was the nurse who was looking after me in recovery, and he was Filipino, smashing chap, and he saw me waking up and chatted to me and encouraged me to wake up, and said I'd been there about half an hour already, and the operation had taken about an hour and 3/4, and then I stayed with him for another half an hour until I came round fully and had a couple of sips of water, and then they wheeled me back down. I was already back in my bed. I'd been transferred into my bed off the operating table, and they wheeled me back down the corridor to the Charmwood suite, where I arrived at about 2:10. So I'd been away 10 to 11, 10:11, 12, 1:10, 2, and then about 3:10, it was all 10 from then on. From about 3:10, they brought me a sandwich and a drink of water. I just asked for water. They wanted to bring me tea or coffee, but I just asked for water, and I drunk quite a bit of water. I was very dry after the general anaesthetic, I suppose, and I'd been breathing oxygen in recovery as well, so that could probably have dried things up a bit. And I was just tender in my eyes, not pain at all, just tender, and couldn't see anything, just completely blurred with the ointment that had been used. And 3:10, they brought me the sandwich and the water. 4:10, Mr. Watson arrived and had a look and had me following his finger and so on, and said, good, it's not quite where I'd like it to be, but we'll tweak it on Tuesday, and that's it. Have I got any do's or don'ts? And he said, no, just keep out of the wind, and when you get a shower or a wash, be careful not to get soap in your eyes, and don't rub them, just dab them. And then I've got some ointment to put in 4 times a day, and that just gums the works up, but everything's just fine. And I'm glad to report that I'd got headache, but not severe. I'd got a sore throat, which is a bit better today, but the sore throat was caused, and the anaesthetist explained that to me, the sore throat was caused by the breathing tube that they'd used, and the sore throat was a likely outcome, and that has happened. But it's quite a bit better today than it was. But what I have developed today is a bit of a cough, and when I cough, the bottoms of my lungs are sore, and I think that might just be anaesthetic as well, but I'm not unduly worried. And I think that's about it, really. It was unbelievably easy, and I have to say all the apprehension about the anaesthetic was completely just unfounded. I didn't feel ill. That was the first thing that Ren, in the nurse in the recovery room, asked me, did I feel sick? And no, I didn't, and I haven't. and that's just brilliant, and I'm just so pleased to have got this far, and so grateful to Mr. Watson's team at the James Paget, and I couldn't have been looked after better. I really couldn't, and I was careful to thank them on leaving, and my cousin Pat and Kath came and picked me up, and I got home about 9 o'clock last night. And so what I intend to do is just I can still switch eyes, left and right eye. I'm looking at the camera with my right eye now, and now I'm going to switch over to my left eye like I did yesterday. And you can see that the difference is much less back to my right, because that's the most comfortable one to look with. But the bruising, he said I'll have two shiners, two black eyes, but the bruising is minimal really. I mean, my eyes are red and bloodshot, but they're not the black eyes that I imagined them to be. I imagined a lot worse than this, so I'm quite happy with how things are. I feel well myself. I feel happy to have come through it okay and be able to speak to you again. It's always a bit of a concern having anaesthetic when you're in your advanced years. And healing is slower and less complete apparently as we get older, but that's just one of the joys of growing old. So I'll just put my specs back on now. Oh, I can see you now. And I'll bid you good night. This is what are we? This is 12, 24, 36 hours. 36 hours after the operation. It's about 11 p.m. the day after now, so that's about, yeah, 24, 36 hours after the post-op, as they say in the trade. So I'll leave you at that and bid you good night, and I'll get this up on YouTube alongside my other submission, and you'll be able to see both bits. And then as time goes on, I'm just going to put my last ointment in now, which is pretty tricky on your own. Drops are alright because they just drop in, but ointment is tricky because it's a string which comes out of the end of the tube, and it's really tricky to get it in there. But anyway, I'm doing it, and I'll come back and speak to you as things change. Really, I expect I'll leave another couple of videos if you're interested, and hope it's been helpful and reassured people who are thinking about it themselves. And at least I'll come back and speak to you after Mr. Watson's done his tweaking on Tuesday, so that's the day after Easter Monday. And so I'll bid you good night and thank you for looking. Bye.